Hey to all those seeking vibrant health. Dr. Rachel Northern here in Johnsburg Chiropractic Wellness Center. And today I'm showing bird dog, I call bird dog exercise. And this exercise I give to a lot of my patients. A lot of my patients tend to have their not very strong core. Unfortunately, it's a weakness in our whole society unless you work on it. And so, part of it is because a lot of people sit during the day and there's not a lot of strength in this back side of the sacral muscles. This is the sacrum. This is like both sides of your ilium. Your pelvis is actually 3 different pieces. And so what I want to do is try to get the little tiny muscles that stabilize the back side of the pelvis, and a little bit of the front side of the pelvis, just to activate those to help the pelvis stay in place, because a lot of people who come in are subluxated. One or both sides of these are rotated, and that starts to cause problems. It can cause sciatica, it can cause low back pain. If you ever have those symptoms where you've been sitting for a long time and you get up and you're like, there's a grabbing feeling, sometimes that's possibly because those muscles are weak or you're subluxated in that area. So the bird dog exercise is where I have people to get on all fours. This is what in yoga we call this like the table pose. You want to make sure your shoulder and wrist are over each other. Same with the knee and the hip. I have a lot of people who are like too much forward like this, too far back, or they have their knees too close together. So you want to have your knees just equal over your hips and just like a table, so you're nice and steady. And I usually have people start off where they lift one leg, and you want to hold it. Now, it doesn't matter. I don't want the leg really high. It's just enough to take the weight off the knee. If you can make it straight, that's fine. And the point of this exercise is to make sure you can keep this flat, stable right here. This area should stay very, very flat. Most people, when it's weak, they overcompensate and they tip that way, or sometimes they drop down. So you want to keep that. I even tell people sometimes you can try to just balance a book there to see if you can keep it stable. And now bird dog, the full bird dog is doing like opposite hand extended, holding for about 5 seconds, going back down, then switching to the other side. Again, you want to make sure this stays stable. Now I have people in the office try this out and they're like all wobbly. If you can't do it very securely at first, then I just tell people just stick with the legs until you can get that really strong and flat. Once you get there, then you can move on and progress to lifting the arm with it. Now, some people have trouble with knee problems. So I tell those people you can just either get a low hanging table, like a coffee table, or you can even do the wall, or like a bench or coffee table, and just do kind of try to do the same thing. Get your legs apart and just lift that leg. And again, just trying to keep this really flat and stable if you have problems with your knees. Just like I said, we want to strengthen and activate some of these muscles in the pelvis that are not being exercised enough. Another thing too to help with that is if you can get one of those big exercise balls and use that as a desk chair periodically. The 75 centimeter one is really good for desk height if you have that possibility, if you work from home, or even if you're sitting watching TV. You can just sit on that for 45 minutes a day just to activate those little pelvic muscles. So thank you.